September 29th, 2018, I get a voicemail on my phone. It says, Mr. Couch, this is Dr. Grisby from the hospital. I wanted to let you know that your father, Vernon, fell. We're going to send him, I'm having my nurse send him to get checked out at the hospital. Just make sure there's not any hemorrhage or internal bleeding. Okay, so Dad fell. I show up at the hospital and I walk into the ICU, which is where I'm led. Now that nurse, different story. Your father's severely dehydrated. He's over-medicated. He's malnourished. He has an acute subdural hematoma, bleeding on the brain. It was touch and go for 4 days. We didn't know what was going to happen as the ICU detoxed and rehydrated him so as to try to get some brain activity. But my dad never spoke again. I later found out that the facility that he was in before, he had actually fallen 16 hours earlier at 5 o'clock p.m. And it was 9 a.m. the next day before they said, maybe we should get him checked out. For 3 weeks, I stayed by my dad's side, 24/7. I ate, I slept, I was right there as his advocate. Why? Because when I found out what they did to my daddy, I said, this will never happen to you again. Dad, we're either going to walk out of here together or I'm with you until the Lord takes you home. And we didn't walk out together. But I can tell you, those 3 weeks spent with my dad were the most fruitful time we've ever had together. Ever. And I got to hold him right next to me. And I got to look into his eyes as he took his last breath. Now, 3 months earlier, my 77-year-old former All-American collegiate athlete, Dad, was doing 50 push-ups a day. I mean, the dude was super active. And now he's crashed. At the ICU, they were incredible. But he still needed an advocate. Because prior to getting there, he was isolated. He was malnourished. He had been given drugs to the point that he had become a zombie. He was effectively like a prisoner of war in isolation, and he was acting as such, so he was super aggressive. Now, as I get there, I'm looking around, and I'm trying to figure out how do I help, because when I show up, Dad's fine. But when I step away, Dad becomes super agitated. He's really aggressive. And I'm like, how do I help? Well, about 3:30 in the morning, one of the nights that we were there, an ICU nurse walks in, flips on the lights, walks up to my dad, sees a loose EKG, and rips it out of his chest and then walks off. My dad comes up swinging and would have hit him with a crashing blow, except he's tied to the bed. So his son, who's sleeping right next to him, jumps up and about smacks the guy myself. And he's like, man, he was aggressive. I'm like, are you insane? He hasn't slept in days. He's completely over-medicated. You flip on the lights, you rip this thing out of his chest, you don't say a word. How would you expect to respond? How would you respond in the same situation? It's absolute insanity. And that's when it hit me. That's when it hit me, this disconnect that I was seeing. Like, why is my dad this way? And I found out the key to empowering each one of us to be advocates, but also to help every doctor and nurse with their bedside manner. And it's only 4 steps. Step number 1, you got to talk to them. Now, patients, whether they're responding or old, they still understand. So talk to them. Secondly, inform them. Let them know what you need to do. God forbid, let them know if it's going to hurt. 3, respect. Don't tell them what you're going to do. Ask them to do it. And then number 4, ask for their permission, right? So, and when you do that, count to 3 if it's going to hurt, okay? Talk, respect, inform, permission. Trip. Think of it like a trip. So the next time you have a trip to go see a patient down at the end of the hall, you want to do that. Talk, respect, inform, permission, AKA the golden rule. Do unto others as you want them to do to you. Treat them like a human. Once I saw the problem, was able to verbalize it, then we were able to come up with a plan. They listened, we implemented. So the next morning, when the ICU team went to take a trip to see my dad, I played like I was asleep. They came in and did exactly as we had talked about, and Dad, for the first time, responded perfectly. Perfectly. Not once again was he aggressive with the staff. Even when he was in pain, like if it was something that hurt, you would hear him groan like a tough little boy, but he was no longer in this I'm being tortured mentality. Now we were a team working together. That's what it does. Talk, respect, inform, permission, trip. If you want to be an advocate, it's easy. You got to show up, you got to speak up, and you got to join the team. Team up, because it takes a village to do this. That's my mission and cause. My name's Eric Couch, and I'm a senior advocate. If you want to be a part of the cause, then we need you, because it's going to take a village.
Yeah!
Thank you.
Eric Couch.